These drugs work well to lower stomach acid, but they may cause some serious side effects, according to 5 critical reports in today's Archives of Internal Medicine. Researchers, for example, found a 25% increased risk of bone fractures in women, and in both sexes, an almost 75% increased risk of a serious intestinal infection known as C. diff.
They can change the bacteria that live in your body and therefore possibly predispose you to an infection.
And previous studies have found patients on these drugs have a higher chance of getting pneumonia. An editorial in today's journal says more than half of prescriptions for these drugs are unnecessary. They're often given for complaints that are not relieved by lowering stomach acid.
We need to be better at making the diagnosis, and number 2, we should only give these medicines to patients who really need them.
While these drugs appear to be safe for most people, there are alternatives that don't involve medication, Katie.
What are some of those alternatives, John?
Well, first, if you're smoking, you have to stop. And then try to avoid things that increase acid reflux, like alcohol, caffeine, fatty or spicy foods, chocolate. You can try elevating the head of your bed at night. Don't eat within 3 hours of bedtime. And then finally, if you're overweight, try dropping a few pounds. Also, if you find that you're on these pills for years and years, that's too long to go without talking to your doctor and saying, hey, is there something less powerful I can take? Maybe I can just take them as needed.
All right. Dr. Jon LaPook, very important story. Thanks, John.